Hi, my name is Susan Dreyfus, and I'm proud to serve as the Secretary of the Department of Social and Health Services for the state of Washington. I want to thank you for listening to this video today as we work with you in helping you to do the very best you can do to help us care for the children in out-of-home care in the state of Washington. I think you and I would agree there's no worse time in America, in our state, or in our neighborhoods when a single child is not safe within their own homes, where their needs are able to be met by their own parents. When the state steps in and says that we need to remove a child from their home, that is a time that we are taking on an awesome responsibility and an awesome complex challenge in making sure that these children are safe, that their needs are met, and that we're able to give them the strengths and the resiliencies that they're going to need for a lifetime. And I just again want to thank you for that answering that call to service and working with us as caregivers in our system. When you look at adverse childhood experiences, we all know now clearly through the research that children who have experienced abuse or neglect, children who have experienced the inconsistency of caregiving, children who have not experienced quality health care, whether it's behavioral health, physical health, or oral health, are at great risk of chronic illness and disease, not just during their childhood, but throughout their lifetime. So the responsibility that we take on when we remove a child from their home is one that we all take very seriously, and making sure that we effectively manage their health care is one of those responsibilities that I know you share with us. This is such an important job. It's one that I don't think any one administration or any one area of responsibility can take on by themselves. And so I brought together here in the Department of Social and Health Services two great administrations between the Children's Administration and our Medicaid Purchasing Administration to make sure that together they took the individual strengths and skills of those two administrations, the expertise and the experience that they have, and brought them together to make sure that we are not just making sure that children have access and coverage for their health care needs, but we are truly doing it with you and with them and with providers of health care, behavioral health, and oral health to make sure that we have quality and that we have good outcomes. Washington, once again, is going to be leading the nation. And we can be very proud, although we have so many things that we know we want to do better at and improve. This is one more area where we will be a leader in the nation in truly putting together a health care delivery system for children in out-of-home care that is seamless, that is easy to access, that works closely with our caregivers, because without you we cannot get this job done, but also works with families. Because at the end of the day, I also know that you share with me a goal that what children want more than anything is to be with their forever family, whether that's back with their birth family or with an adopted family or through relative care. So thank you. Thank you for answering this call to service. Thank you for doing what I know will be your part in helping us make a health care delivery system for children in out-of-home care in the state of Washington the very best that it can be. Take care, and God bless.
There's nothing like feeling good. And feeling well goes a long way in helping our children succeed at school and at home. And for our out-of-home care children, being healthy and staying healthy is of utmost importance in overcoming the challenges of out-of-home placement.
I think that one of the greatest responsibilities that we have in the public child welfare system is to ensure that children reach their full potential. And the physical, the emotional health of children, to me, is a part of our responsibility. And I think children cannot be as successful if they are not healthy.
The Fostering Well-Being program is designed to do just that. DSHS's Children's Administration and Medicaid Purchasing Administration have partnered to provide a comprehensive program that will help our children improve and maintain good health.
Medicaid Purchasing Administration is well positioned to do this work because we have the kind of staff that are used to doing this kind of activities out in the community and working with communities. We have nurses that can help support these activities and do the care coordination and understand the health care needs of these children. We also have physicians that we can consult with on staff and the regional medical consultants that we can consult with. We have the infrastructure to go out and work with the community providers more closely. And this is just the kind of work that we do already, and we've done it for individuals with chronic disease. We do it through our health plans that we contract with. So our expertise is in how to make sure that our populations get appropriate health care.
One of the things that I think is so exciting about this collaborative partnership is that the child welfare system, and I speak as a social worker with some years of experience in the field, but I'm not trained as a healthcare provider. I'm not trained as a nurse. And so through this partnership, our social workers have the opportunity to really work with nurses who are trained in this field, who do bring expertise, and who help us really to ensure that the children are getting their health care needs met.
The Fostering Well-Being program will place a heavy emphasis on receiving early periodic screening diagnosis and treatment, or well-child exams.
Well-child exams look at the dental, the mental health, the developmental health, physical health of the child, and pull all that together to understand the picture of that child and what they may need beyond the physical reasons that they may see a doctor. The doctor can say, you know, this child is not on par for developmental to be into kindergarten, and so they can recommend or refer that parent or caregiver to programs that can assist the child in making sure they're on developmental par with their peers when they start school. As far older kids who may have mental health issues, they're not going to get the mental health that they need in the doctor's office, but there is a primary care provider or a medical home who is looking at the child in the big picture and making sure that the services they need are connected and coordinated for that child.
In foster care with...
Yes. Prior to this program, when we would see a foster child, often it would be with no health history, which makes it pretty difficult to do a good job of getting the child the complete medical treatment that they need. And so the goal of this program is to provide the caregiver that health history from the beginning, so that when they come to that doctor's visit, there's better information about the child's past history and medications and all of those things that could be really important in making good medical decisions for that child.
For caregivers to partner with us and take that child in within the first 30 days, we'll give a baseline of all of those issues for that child when they come in, and give us a direction that we need to go. We, the department, we, the caregiver, we're all one, trying to make sure that that child has better outcomes in their health and well-being as they're in care with us. Whenever it is possible to get that child in within the first 30 days is so important, because that child may leave care. A lot of kids leave care pretty quickly, and they may never have been into the doctor prior, but if we can get them that health information so that as they're transitioning home, we can provide that information to the family and make it easier for their family that they're returning home to care for them.
The program depends on caregivers completing this important first step. These exams will establish a baseline assessment of the child's current health status and provide a pathway to better health maintenance.
I believe the children in foster care, that we'll really start to see some improved health outcomes, that we'll see better well-child exams, getting them done earlier and in a more comprehensive way. Also making sure the children are immunized. So really being able for those children that are generally healthy, being able to screen them for any conditions to make sure that those conditions have been identified, and coordinating better with their primary care provider, their health home, around what their needs are.
It will provide caregivers with a detailed health report for the child, so they are aware of health concerns that need to be addressed. The reports will contain information about medical diagnoses, medical provider clinic visits, hospitalizations, ER visits, medications, and immunizations. You will need to give a copy of this report to the clinic when you take your child in for services. It will inform the healthcare provider about your child's health history, yielding better care for your child and keeping the child's medical record current. In addition to maintaining a comprehensive health record, the Fostering Well-Being Program will provide caregivers assistance with Medicaid eligibility and payment for health services. It will manage the necessary coordination between caregivers, case managers, and health service providers to facilitate a smooth process for obtaining child health services. Social workers will have access to 2 years of medical records so they can have insight into any health issues needing special attention.
Yes, that's Bella.
Hi, Bella.
And for children with medically complex issues,
How are your ears doing today?
the program will help recognize their needs at the outset and better serve these children.
The Fostering Wellbeing Program is able to look in the information technology databases that we have available to us within the state and identify children who have complex health needs. So they may have multiple diagnoses that affect their physical health, like cerebral palsy and mental retardation. As in addition, they could have asthma or some other chronic health issues that cause it to be difficult for caregivers to provide the right care for the child. So to identify those and make sure that the doctor who takes care of the child for the cerebral palsy is connected to the doctor who addresses the developmental issues for that child, and they have the communication in place is really important, because then again you're not having that child bounce around from doctor to doctor and having them re-diagnosed and never ever moving beyond the diagnosis of saying there's something, you know, that the child has cerebral palsy or they have mental retardation. Now we can move beyond the diagnosis and start addressing that child's ongoing health issues.
Care coordination services for children with medically complex issues will be provided on a case-by-case basis, depending on the severity of each child's needs. Please contact your social worker if you have questions about your child's potential eligibility.
Now caregivers can make contact with the Fostering Wellbeing Program and say, you know, I don't know what this means. What does it mean if the child has a cardiac problem, and what special training do I need to have so that I can care for this child appropriately? In addition, it allows social workers to say, oh, that child has this cardiac problem. We need to make sure the caregiver knows that and can get the right training, and so that they're prepared and aren't caught off guard by special circumstances of caring for the child.
The program will also provide health education for caregivers so they can be involved in helping our children stay healthy.
The electronic information that we have available to us in the department will allow us to target specific types of diagnoses that children can have, such as asthma. So we'll be able to match the placement information that Children's Administration has with the diagnosis information that MPA has, Medicaid Purchasing Administration has, and combine that and mail out information that will help caregivers understand the diagnosis of the children in their homes.
Feeling good. That's what life should be about.
It's just been such a great opportunity for all of us within MPA to be able to partner with Children's to really look at ways that we can improve the health status of children and the community that they live in. And when we see foster children as they move along the continuum and move from foster care into adulthood, that we'll be seeing healthy individuals that can go on to college, that can go on to a bright future.
Be part of the well-being team. Play a role in keeping our children healthy and successful.